Your kidneys are quietly becoming one of the leading causes of death worldwide. And the scary part, up to 90% of people with kidney disease don't even know they have it. In this video, we're diving into 8 warning signs that your kidneys are crying for help, and make sure you stick around till the end. I'll share some super simple tips to protect these vital organs. Your kidneys, located on either side of your lower back, work as the body's natural filtration system. They don't just flush out excess uric acid. They also balance key minerals like calcium, sodium, and phosphorus in your blood and help regulate your blood pressure. Kidneys are also critical for red blood cell production and maintaining healthy hemoglobin levels. Even vitamin D from sunlight or food needs your kidneys to be activated and do its job. So when your kidneys are in trouble, all these vital processes get thrown off balance. The problem is, early-stage kidney disease is notoriously silent. You might not notice anything wrong until the damage is severe. Studies show that by the time most people are diagnosed, they've already lost about 80% of their kidney function. But don't worry, if you pay close attention to the early signs, you can catch the problem before it's too late. First warning sign, blood in your urine. Normally, we pee about 6 to 10 times a day. But if you suddenly start peeing much more or much less, or you're waking up multiple times at night to go, it's a red flag. Feeling the urgent need to urinate, but struggling to do so, or experiencing pain when peeing, could be a sign of kidney stones moving through your urinary tract. And seeing blood in your urine can signal a kidney infection, a tumor, kidney stones, or even kidney failure. When your kidneys aren't filtering properly, blood cells can leak into your urine. If your urine turns reddish-brown or purplish, women might sometimes mistake it for a delayed period. But heads up, foamy or bubbly urine is also a major warning sign. When your pee looks frothy or almost like beaten egg whites, it means there's a large amount of protein leaking out. Normally, protein should stay in your bloodstream, but when the kidney's filtering system is damaged, proteins like albumin spill over into the urine. Fun fact, albumin is the same protein found in eggs. That's why the foam looks familiar. Since the kidneys produce urine, any change in color, texture, or frequency should never be ignored. Second warning sign, constant fatigue. Healthy kidneys filter waste out of your blood, but when they're struggling, toxins build up, making you feel tired, weak, dizzy, and foggy-headed. Your kidneys also produce erythropoietin, a hormone that tells your body to make red blood cells. Red blood cells carry oxygen throughout your body, so fewer red blood cells mean less oxygen and less energy. That's why even if you sleep a full night, you might still wake up feeling absolutely drained, a silent sign of kidney trouble. According to nephrology experts, when fatigue is caused by kidney disease, you might feel too exhausted to even shower or walk a few steps. This condition is called anemia from chronic kidney disease, and the worse the anemia gets, the more severe your fatigue becomes. Of course, fatigue can be caused by many other things, too. The best way to know for sure, get a blood test to check how your kidneys are doing. Before we move on to the next warning signs, take a second to share this video with your loved ones. If you find this information helpful, smash that like button. It really supports the channel, and don't forget to hit subscribe so you won't miss any of our life-saving health videos coming up. Third warning sign, unusual swelling. If you notice your ankles, feet, or the area around your eyes are puffy, especially in the morning, don't brush it off. When your kidneys aren't working properly, fluid builds up in your body instead of being filtered out. Weak kidneys also cause sodium levels to spike, leading to even more severe water retention and even worse, swelling. Thanks to gravity, this extra fluid tends to collect in your lower body, like your legs, ankles, feet, or even your hands. Now, swelling can also be linked to other conditions, like heart disease, liver problems, or chronic venous insufficiency. Plus, low protein levels, especially albumin, can make the swelling worse. Because the kidneys and liver work together to balance fluids, persistent swelling could be a big red flag that your kidneys are struggling. Fourth warning sign, shortness of breath. Normally, we think breathing problems mean heart or lung issues, but guess what? Weak kidneys can be behind it too. When your kidneys can't filter out extra fluid, it can build up in your lungs, making it harder to breathe. Plus, fewer red blood cells from kidney disease mean less oxygen in your blood, which also leads to that suffocating feeling. In severe cases, just lying down can make you feel like you're being crushed. If you're experiencing this, don't wait. See a doctor immediately. Fifth warning sign, dry and itchy skin. One of your kidney's main jobs is to remove waste and balance minerals in your body. When they can't keep up, toxins build up and your skin can become dry, rough, and insanely itchy. Kidneys also help maintain the minerals that keep your bones healthy. So when those minerals are out of balance, it often shows up through your skin. Some people experience localized itching, but when it spreads across multiple areas or your skin turns yellowish or brownish, that's a serious red flag. In fact, about 10% of kidney disease cases are first caught through skin symptoms. If you've tried every lotion and treatment and nothing's working, it might be time to look deeper. Your kidneys could be to blame. Sixth warning sign, bad breath and a metallic taste. People with kidney issues often complain that food tastes like metal and their breath smells foul. This happens because urea builds up in your blood when your kidneys can't clear it out. That uremic buildup doesn't just change how things taste, it can make you feel nauseous, lose your appetite, and even feel sick at the thought of eating. If you notice these changes, don't ignore them. They're clear signs you need to get checked out immediately. Seventh warning sign, trouble sleeping. When your kidneys aren't doing their job, toxins stay in your bloodstream, making it harder for your body to relax and fall asleep. This can even trigger serious problems like sleep apnea, where you stop breathing repeatedly while you sleep. People with sleep apnea often snore loudly or wake up gasping for air, and it leaves you feeling exhausted all the time. Poor sleep only makes kidney disease worse, creating a vicious cycle. Eighth warning sign, high blood pressure and diabetes. Okay, these aren't symptoms by themselves, but if you have either of these conditions, your kidneys are already at risk. In fact, about 40% of kidney failure cases are linked to high blood pressure, and 1 in 3 people with diabetes will eventually develop kidney damage. High blood sugar thickens your blood and damages the tiny vessels inside your kidneys. High blood pressure, on the other hand, puts intense pressure on those fragile vessels, wearing them out over time. And here's the catch. Damaged kidneys make blood pressure even worse, creating a dangerous, vicious cycle. If you truly want to keep your kidneys healthy, pay close attention to what I'm about to share. Keeping your blood pressure and blood sugar under control is crucial for protecting your kidneys. The sad truth is, early warning signs are often ignored until the kidneys are already 70 to 80% damaged. But here's the good news. Kidney damage can be reversed if you start making a few simple changes today. First tip, stay hydrated. Experts agree that dehydration is one of the leading causes of kidney stones and kidney infections. Aim for 4 to 6 glasses of water a day to help your kidneys stay in top shape. Even better, warm or hot water seems to have extra benefits. One study found that drinking 1 liter of hot water within 30 minutes helped reduce creatinine levels by up to 20% and urea levels by up to 40%. Second tip, be cautious with medications. Over-the-counter anti-inflammatories like ibuprofen and naproxen can damage your kidneys if used improperly or excessively. Even antibiotics can strain your kidneys, especially if you're already at risk. If you have kidney concerns, always check with your doctor before taking powerful medications like penicillin, sulfonamides, auto-inhibitor, or other strong antibiotics. Third tip, get moving. Regular exercise doesn't just benefit your heart, brain, lungs, or waistline. It's also incredible for your kidneys. Simple activities like jogging, biking, swimming, or even just walking daily can make a huge difference. And if you're over 60, were born with low birth weight, or have a family history of heart disease, make it a habit to get your kidneys checked regularly. Your kidneys are your body's natural detox powerhouse, but most people only realize how important they are when it's already too late. And once major damage sets in, recovery becomes incredibly difficult. So, remember the early warning signs we covered today, and start making small lifestyle changes right now to keep your kidneys healthy for years to come. Thanks for watching, and I'll see you in the next video.